my knowledge of Hong Kong comes from chairing the Hong Kong government SARS inquiry in 2003. And so when this virus started, it looked very similar in many ways. It started in the same sort of origin, a new disease linked to a wet market, possibly to eating exotic foods, then started to take a grip, and we've been able to look back at the lessons we learned in 2003 and see how much of that has then been able to be applied. And I know that within the Hong Kong government, the experience of SARS has been a very important one, and has helped to guide some of the actions they've taken, which may to some of us appear draconian at the time, but I think in retrospect we're now going, maybe for ourselves.
China is different cultures, isn't it? React differently, and that's what
Yes.
we were talking about earlier. We had some breaking news earlier from Dr. Jenny Harries, the Deputy Chief Medical Officer, who's now said that thousands in the UK could be infected, could contract coronavirus. Does that surprise you, those figures, or not?
Not really, no. If you look at the figures in the rest of Europe, we're seeing numbers jumping up in our neighbours, France, Germany, and obviously Italy, and also Spain. And as the numbers go up, we're looking to China, to the lessons that we can learn from the Wuhan epidemic. And the research shows that if we were to get to an 80%, that's very, very worst case, 80% of the population getting the disease, then 80% of those people would have mild disease, might not even really notice it as different from a flu or a cold. Of the remaining 20%, it's only 1 in 100, it's 1% who may not survive, and they're more likely to be elderly and to be sick and to have chronic diseases. So although it sounds a bit harsh put like that, it's actually what we saw in SARS. The SARS epidemic initially infected healthcare workers, then it spread into the community, and that was the anxiety. Community spread, when you can't trace the disease, is what's worrying you, and then the tail off was older people, immunocompromised people.
Well, there's huge anxiety and huge panic, and we see it in social media with breaking news. But how would you compare it really to the seasonal flu? There are a lot of people that are saying, well, seasonal flu, if you counted the numbers of people dying from that
not just a lot of people. The president tweeted it yesterday. The president went there, and Sean, I've got the tweet in front of us from the president. He went there, said 27,000 to 70,000 per year from normal common flu.
That's right. So how
well,
does it
what
differ?
that would, the difference with flu is that we immunise against flu, so we can actually, we feel more confident with the virus. This is a new virus and we don't know how it's going to behave. With flu, every year a new virus comes out, a new vaccine comes out based on experience across the world, which again emphasises the need for global spread of information and sharing of scientific information. So the vaccine for flu that we get reduces the risks from flu and reduces the number, but maybe we should be counting them and saying to people, here, we've had a death from flu, why weren't you immunised? Because the question is, why don't people take up the flu vaccine? The case with coronavirus is that they're racing to make the vaccine, and they're doing really, really well. There's a lot of good progress in the scientific community on vaccine production, but a vaccine takes a long time. Even if we get it within a year, that's good, but you have to do clinical trials to make sure it's safe. So I think this is really about, yes, we ought to take the messages about flu seriously. Maybe next year we should count the cases of flu deaths and celebrate, and actually talk about them and celebrate the ones that are avoided.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.